Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Alberta, we have a challenge, and it's not just our COVID-19 numbers. We are increasingly challenged by polarizing narratives that on the one hand say we need to drive to zero cases at all costs, and on the other hand say that COVID is a mild illness for most, so we should let it spread freely and pursue herd immunity. We are not well served by false dichotomies or by any positions that make it harder to have the respectful dialogue that a complex, wicked problem like COVID-19 presents. We must continue listening to each other and striking a difficult but necessary balance. We cannot live in fear and terror of COVID-19 for months to come. Yet we also cannot abandon our efforts to protect the most vulnerable members of our communities and to make sure the health system can continue meeting all Albertans' health needs. I don't ask that you fear COVID-19, but that you respect it. COVID is a novel disease that is not just the flu. It has the ability to overwhelm our health system and weaken essential services if we let it do so. Respecting COVID-19 means taking public health advice seriously and taking care of not only ourselves, but also our communities by preventing transmission. I also ask that each of us do everything in our power to maintain respectful dialogue with those who have different opinions. We cannot let COVID divide us. We will find better solutions by continuing to work together and finding strength in diversity. Having said that, we are also facing a COVID-19 challenge. You have heard me say many times that we need to achieve a balance between minimizing the risk of COVID-19 and minimizing the risk of harms of restrictions. This requires us to keep the spread of COVID-19 manageable. We have now crossed a tipping point and are losing the balance we have been seeking. Last week, Edmonton Zone moved to defer elective surgeries in order to deal with all the system pressures that COVID is creating. These pressures include not just COVID-19 patients in hospital, but also outbreaks in continuing care that prevent patient transfers, staff shortages due to illness or quarantine, and a need to treat any patient with COVID-like symptoms or exposure with robust infection control precautions, meaning, among other impacts, that multi-bed rooms cannot be used to full capacity. The trigger of COVID hospitalization growth that we have been watching is not above 5%. However, we need to respond to the actual situation, not just the metric chosen in the spring. This weekend's COVID-19 numbers tell the story clearly. We identified on average 480 cases of COVID-19 per day over the weekend. Breaking it down by day, on Friday, 364 new cases were identified, while our lab conducted more than 16,000 tests. On Saturday, we completed over 17,000 tests. We also identified 572 new cases. And yesterday, we diagnosed 504 cases and completed almost 12,700 tests. There are currently 118 people in hospital in Alberta, including 16 in intensive care with COVID-19. One of the challenges of rising cases is that it creates pressure on certain key elements of our COVID-19 response, including contact tracing. We have been working with AHS on new strategies to more effectively and efficiently notify close contacts of confirmed cases of COVID-19. Right now, AHS has more than 800 staff on its contact tracing team. AHS is increasing their staffing as quickly as possible, and they are actively recruiting more people to meet these increasing demands. But we still need to get information to Albertans faster. Effective today, if a positive case attended an event while infectious, AHS will now notify the organizer and provide them with written notification that can be directly emailed to all event attendees. We will be asking event organizers to send these emails within 24 hours of being contacted by AHS. This change will make the close contact notification process quicker for large events. Of course, if an event organizer cannot support this more rapid email notification process, AHS will continue to make these phone calls. AHS will also continue to directly notify close contacts of cases who were exposed outside of any public or private event, and will continue to directly contact anyone who tests positive for COVID-19. Turning to schools, there are active alerts or outbreaks in about 11% of schools, with a total of 680 active cases. There are currently 101 schools with an outbreak, including 39 that are on the watch list, with 5 or more cases. 39 schools have now been removed from the outbreak list as their outbreaks have ended. Parents, teachers, students, and staff are taking their responsibility to protect one another from COVID-19 seriously, and I thank them for their dedicated efforts. So far, in-school transmission has occurred in 79 schools. Of these, 45 have had only one new case result. These are significant numbers, but it is important to keep them in context. Just 6% of all COVID cases in those aged 5 to 19 since September 1st have been acquired at school. This shows that schools are not a main driver of community transmission, but that our rising community transmission is resulting in more school exposures. This reinforces the importance of addressing the rising spread we're seeing in our communities. Sadly, I must report 7 additional deaths of COVID-19. This is a heartbreaking number. My thoughts go out to those families and everyone else who is grieving right now losses of any kind. I know there are many Albertans that are struggling with the loss of loved ones from many different causes. It is to prevent losses from COVID-19 like the ones the families and friends of these 7 people are experiencing, to prevent more growth in those in hospital and ICU with COVID-19, and to prevent further impacts on the ability of the health system to care for all Albertans' needs, that we must collectively commit today to change the current trend of COVID-19 spread and regain the balance that we are striving for. In Edmonton specifically, while the rate of growth in new COVID cases had declined to 1.13 after voluntary measures were announced on October 8th, that has risen in recent days, and the number of cases continues to grow. The average positivity rate for all COVID-19 tests in Edmonton has now increased to over 4%. Hospitalizations of COVID-19 patients and the other impacts of increased community spread have started to impact other services. As I mentioned earlier, due to the demands on the health system, AHS has moved to postpone up to 30% of non-urgent surgeries in the Edmonton zone. This measure will need to remain in place until the COVID-19 demands ease in order to support safe patient care in hospitals in the area. We are all tired, but COVID-19 will be with us for some time. We need to be able to ensure that caseloads do not threaten the health system's ability to support all the health needs of Albertans. When we look at Calgary, the spread is reminiscent of where Edmonton was at several weeks ago. The number of cases being identified continues to rise sharply, and about 4% of COVID-19 tests are now coming back positive. Without additional measures being taken, we risk seeing a similarly sharp rise in Calgary, not just of cases, but also of hospitalizations, which would potentially impact our health system and its ability to meet Calgarians' needs. We are in a crucial phase right now and need to take steps to reduce the rate of growth that we are seeing not only in Edmonton, but in Calgary as well. At the same time, we must continue to strike a balance between limiting the spread of COVID-19 and supporting all the other elements of people's health. This is a delicate balance, and there is no one perfect way to navigate this pandemic. We must rely on the evidence that we are seeing in spread within the province. In the last 2 weeks in Edmonton and Calgary, Social gatherings made up just 15% of all outbreaks, but almost a third of all outbreak-related cases. Workplace outbreaks made up about 15% of outbreaks and outbreak cases. In contrast, there has only been one outbreak linked to a restaurant in the past 2 weeks, and less than 1% of active cases in Edmonton and Calgary are linked to exposures in restaurants. Today, I am announcing new public health measures for the cities of Edmonton and Calgary to help prevent the spread of COVID-19. Effective immediately, we are implementing a mandatory 15-person limit on all social gatherings in Edmonton and Calgary. This limit applies to gatherings where people are mixing and mingling, such as dinner parties, birthday parties, social events, and wedding and funeral receptions. It also applies to special event celebrations like retirement events, baby showers, and other social gatherings. This limit does not change the measures currently in place for events that are structured, such as ordinary dining in restaurants, theaters, worship services, or wedding and funeral ceremonies. However, it would apply to gatherings that may occur before or after these events, such as wedding receptions or a social event at a restaurant or another site. We are following the evidence and implementing a targeted measure that will help reduce transmission and limit the risks of cases growing exponentially in both cities. These social gatherings tend to be less structured and can struggle to implement key measures like physical distancing and hand washing to reduce the risks of exposure. This 15-person limit is temporary. It will be reassessed after 1 month and can be lifted if we see our growth rate, or R value, decline below 1 and new case numbers consistently below 100 in each city. My sincere hope is that we will see cases decline significantly enough to reassess this approach and lift it within this 1 month time. Along with the mandatory limit on social gatherings, 2 voluntary public health measures will remain in place for Edmonton and will be put in place today for anyone living in or visiting Calgary. First, we strongly recommend wearing non-medical masks in all indoor work settings, except when alone in workplaces such as offices or cubicles, where you can be safely distanced from others, or if appropriate barriers are in place. We continue to see workplace outbreaks where coworkers consider themselves to be a cohort just because they work together. This creates risk in workplaces, and I want to remind everyone that COVID prevention measures should be in place between coworkers, as well as between staff and the public. Second, we need to reduce the number of close contacts that people have and reduce the connections between different networks. The tool we are using to accomplish this is a voluntary measure that all those in Edmonton or Calgary should belong to no more than 3 cohorts. A core cohort, including the household and a small group of people with whom exclusively you've agreed to gather, a school cohort, and 1 additional sport, social, or other cohort. Young children who attend childcare may be part of 4 cohorts, given that childcare cohorts have not been seen to be a high risk for spread. Surrounding communities in the Edmonton zone should continue to follow the voluntary public health measures in place to mitigate the risk of spreading COVID-19. No additional measures are being implemented in the communities surrounding Calgary, but all Albertans should continue to stay home if they are sick, physically distance whenever possible, wear a mask when you can't, and wash your hands frequently along with all other guidance in place. The measures are not being taken lightly, and I know they will impact many, but they are necessary to prevent the spread of COVID-19 from continuing to escalate. AHS will also be increasing inspections of public-serving businesses to ensure that existing guidance is being followed and customers are protected. Due to COVID-19's incubation period, it will likely be 1 to 2 weeks before we can begin assessing the impact of these health measures. We will be watching our numbers closely to assess the trends. But the impact of public health measures alone cannot compare to the collective power of all Albertans taking action. I thank the people of Edmonton for their voluntary efforts as of late to control the spread. It has been making a difference to slow the growth rate of the disease. We do not need a rule or an order to do the right thing or to make the smart choice, and the voluntary measures have demonstrated that. However, the rate of growth of these new cases and hospitalizations means we have to step up our efforts even further with this new temporary restriction as well. Our best hope to avoid needing any further restrictions and to keep businesses recovering and the health system readily available is for all of us to go the extra mile. I know this is difficult. COVID-19 is a marathon, not a sprint, and Albertans have been sacrificing and working hard for many months now. But the warning bell is ringing, and I want all of us to hear its call. It has been said many times that we must learn to live with our new normal. This means that in addition to targeting areas of high risk as we are doing today, we must also ease restrictions in areas of low risk. We must not make perfect the enemy of the good. We must make it as easy as possible for Albertans to live with the most important COVID restrictions and lift others where we can. We are working to use our own evidence and learnings from other jurisdictions to adjust our approach when the evidence indicates we can safely do so, and one example is the symptom list for children. We are closely reviewing the symptom list for school-aged children, as the changes made in BC and Ontario did not show a corresponding increase in COVID-19 transmission in schools. This work is nearly complete, and we hope to update Albertans soon on any updates to that symptom list. We are a remarkable province with a long and proud history of coming together and looking out for one another. Let's continue that tradition now by doing our part to limit the spread and by following the guidance put in place as closely as possible. This is the best way for all of us to protect ourselves and our friends, family, and neighbours. We will continue working with AHS, the City of Edmonton, the City of Calgary, and all our local partners to closely analyze and monitor the spread across the province. We will watch the spread closely and consider if any adjustments are needed. Now more than ever, we need to take care of each other and protect each other. As I started by saying, we have a challenge, but our province has faced challenges before. Albertans are not known for turning aside when things get hard. We are stronger in our diversity if we continue to act in our community's best interest and if we maintain our ability to respectfully connect across differences. Thank you, and I will now answer any questions that you may have.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Yes, thank you. The first question is from Kevin Nimick, CTV. Please go ahead.
Hi, Dr. Hinshaw. What's being done to keep people safe at the Calgary Correctional Centre as we continue to see more cases?
As you say, there have been an increased number of cases identified. I don't have the specific details of all local outbreaks, but what I know is that my colleagues in Alberta Health Services and my colleagues at that local level, the local medical officers of health, are working with that facility to make sure that outbreak protocols are in place and that regular testing and isolating of those who are sick or close contacts as a part of regular outbreak protocols is taking place. And so again, this increase in cases has come as they have done broad testing to identify any potentially asymptomatic cases and to be able to really understand where those risks are. And like I say, that local work is underway.
Operator, could you put through the next question, please?
Yes, Julia Wong, Global News.
Hi, Dr. Hinshaw. Last week we heard that the province saw cases stemming from Thanksgiving. That was a holiday where Albertans were told they could gather safely, even though the Prime Minister the day before had said Canadians likely couldn't because of high case numbers. Should Albertans have refrained from gathering for Thanksgiving? And should Albertans be taking advice about gathering for future holidays with a grain of salt, considering the outcome of Thanksgiving?
What I would say is that the important thing is to look at the evidence that we currently have and to use that going forward. You may recall that the advice provided with respect to Thanksgiving was to make gatherings as small as possible, to gather outside if possible, and we did strongly encourage those in Edmonton and surrounding area to reconsider their Thanksgiving plans. Of course, this is something that people are making their own decisions based on their own assessment of risk. And the important thing, again, is that going forward, this risk will not go away. COVID-19 will be with us for many months to come. And so any planned gatherings in the future, it is very critical to think about how COVID prevention will be a part of those gatherings. And again, I think that is something that was part of our new normal, and whether we have a different gathering size or not, we will always need to follow those COVID-19 prevention measures, and that is something that people can plan on and rely on.
Operator, could you put through the next caller, please?
Francois Jody, Radio Canada.
Hi, Dr. Hinshaw. Thank you for taking my question. You've probably seen the strike today from AUCP, AUP employee union members today. Some of them, from what we understand, were working at in the lab services. Do you know if there's been any disruption to COVID testing because of the strike?
I don't know. I don't have that information at this time.
Operator, could you put through the next caller, please?
Gary Tate, Globe and Mail.
Thanks for taking my question. Dr. Hinshaw, with respect to the strike, can you explain how that would affect the healthcare system and patient stability?
That's not part of my role with respect to the delivery of specific patient care, but of course, I would say that every worker in the healthcare system is important, and that's something that is a constant across all times and places.
Friendly reminder that Dr. Hinshaw's expertise is Alberta's public health response. Operator, could you put through the next caller, please?
Don Reed, Calgary Herald.
Dr. Hinshaw, this is probably an uncomfortable question for you about the intersection of a wildcat strike in the healthcare system with the healthcare system that you're trying to keep available for COVID patients. But really, could you give us some assessment of what you think the risk or possible consequence of a spreading wildcat strike will be on what you're doing? Is there potential harm to patients? Could we have your view?
Again, my perspective is that the COVID measures that are in place, combined with staffing shortages that we already were seeing because of COVID issues and respiratory virus season, of course, if there are impacts on staffing for any other reason, whether it's the strikes or any other reason, that could lead to changes in the ability of services to be offered. But I know that Alberta Health Services is working very hard to ensure that COVID precautions are in place and that continues, and whether or not they have to adjust the services that are provided.
Operator, could you put through the next caller, please?
Bill Copton, Post Media.
Yes, Dr. Hinshaw, continuing on with this wildcat strike issue, I'm just wondering if you could tell us how many surgeries are being postponed due to this.
The information I have about surgeries being postponed is specific to the measures that were put in place in Edmonton last week related to surge issues in terms of that COVID impact, which was up to 500 surgeries a week was the number that I was aware of. I do not know if there are any additional surgeries that are needing to be postponed because of the current strikes.
Operator, could you put through the next caller, please?
Jeff Slack, 660 News.
Hi, Dr. Hinshaw. Just wondering, with Halloween coming up and the recent surge in numbers, are you concerned that after a week or so after Halloween that we could see another spike in new cases? And also, I guess, what's your message to the young adults who do plan to get together on Halloween, because it's kind of a normal thing to do for those who are ages 20 to 39?
My message to those ages 20 to 39 is that this is not a normal year, and this is not the time to engage in normal activities. And Halloween is not a, really any gathering, whether it's Halloween or another event. I would recommend that as people are planning what they might want to do, that they reconsider having parties, that if they are going to have an event, they consider potentially having it outside if possible, that if it's in Edmonton or Calgary, that it be no more than 15 people, and that the gathering that happens would still, as much as possible, be looking at masking if people can't maintain distance. And with Halloween, the mask can be incorporated into the costume, so that's the upside of Halloween. The request, I know it's difficult, and particularly for those who are between the ages of 20 to 39, where their individual risk of severe outcomes is quite low. It can be difficult to ask them to make these sacrifices, but what I would say is, as they're thinking about who they care about in their lives, who is over the age of 70, who has chronic health conditions, and as I mentioned last week, the possibility of having prolonged COVID impacts, even in someone who is young and healthy, they think about caring for themselves and caring for those other people in their lives by keeping those gatherings small and responsible this year. With respect to whether we would see an increase in cases following that, again, if people are disregarding the measures, then it is possible that we could see that escalation. And I would again ask that people are thoughtful and care for their communities in this way.
Operator, could you put through the next caller, please?
Breaking news today, St. Albert Gazette.
Hi, Dr. Hinshaw. I do have two questions here, if that's possible. The first is regarding the COVID-19 outbreak at a St. Albert senior home. We learned today from Alberta Health that there are 38 active cases of COVID-19 at the St. Albert retirement residence, and then we learned from the home operator that the cases were linked as early as September 28th to this outbreak, but we just didn't see the outbreak listed on Alberta Health's website until this week. So can you comment on this outbreak in St. Albert, and then explain why it took so long for Alberta Health to list this on its website?
The outbreak has a total of 41 cases, 38 are active and 3 recovered. I don't have the details of this specific outbreak and why there was any difference in when an outbreak was declared versus when it was posted. What I can tell you with respect to our typical policy is, if a single case is identified at a long-term care facility, and most often this is a case in someone who works at that long-term care facility who potentially attended work while they were infectious, and I will remind people that we consider someone infectious for the 2 days before their symptoms started. So a long-term care worker may well have done everything right, stayed home as soon as their symptoms started, but potentially was infectious those 2 days prior. And when we see that happen, we declare an outbreak at that site with that single case. However, we do not post it publicly at the time of that single case, because at that point in time, there is no transmission within the facility. And in fact, the vast majority of those outbreaks with one case, there is no spread in the facility, and the measures that are in place to prevent that are effective. Unfortunately, in some cases, spread does happen, and when we do see spread happening in the facility, that is the point in time that those outbreaks are posted publicly. So while I don't know the specifics of this case, and we can investigate that, it may have something to do with that typical process of starting with the local response, but only moving to public reporting when we do see a transmission event within that facility.
Operator, could you put through the next caller, please?
Lauren Krugel, Canadian Press.
Hi, good afternoon. With regards to new limits for certain events in Calgary and Edmonton, I'm just wondering, given that these take place kind of in private settings, how would you enforce that? I mean, how do you make sure that people actually follow the rules when these are happening in homes and in places like that?
First of all, we know that these kinds of social events can happen in multiple settings. So they can happen in community halls, they can happen in places where there's a kind of a rental that happens there. And so where there is a more formal location, that's where there's an opportunity to make sure that those who are operating those settings are using this current measure to ensure that if somebody is going to be planning a gathering, that they're aware that they must have less than 15 people or less, I should say. If there's a gathering planned in someone's home and it's more than 15 people, then ultimately, again, what we're relying on is the cooperation of those in Edmonton and Calgary to take this opportunity to make the decisions that are right for their community to prevent the spread from happening. If there is a complaint that is put in by a neighbor or someone who's aware of something being planned, then Environmental Public Health would be able to connect with that individual in advance if there's a complaint made in advance about something being planned. And there is that possibility of issuing tickets if there are egregious violations of this. But as I said before, I know the vast majority of Albertans want to do the right thing, and this is the way that we can care for our communities. So ultimately, again, I really am urging Albertans to see this as their chance to save our healthcare system and to prevent spread to high-risk individuals.
All right, we've got time for 2 more questions. Operator, could you put through the next caller, please?
Shannon Scott, CBC.
Oh, hi, Dr. Hinshaw. You mentioned in your opening statement that watching the hospitalization rate is something that was set in the summer, and we may need, that may not be the best metric. Could we be seeing changes to where you feel that metric should be before potentially more restrictions come into place?
The metric that we're using today or the metric that was used to make this recommendation and then to have this measure go forward is that metric of our hospital system capacity, and recognizing that in Edmonton, the capacity has exceeded 120%, that surgeries are being postponed, where we see an actual impact on the system. So whether or not we adopt that as another formal metric to consider, again, we are acting on that because there is a clear impact on the health system. And because the trends that we're seeing in Calgary are almost identical to what we saw in Edmonton 2 weeks ago, we want to make sure that we don't end up in a situation where both of our tertiary care centres are in an overcapacity protocol situation at the same time, which not only limits access to health services like non-urgent surgeries, but also leaves us much more vulnerable should we have a large hospital outbreak or some other situation. We would have very minimal surge capacity. So that's why, again, we're using this particular metric of hospital capacity as an additional piece of information to inform the need for measures.
All right, operator, could you put through our final caller, please?
Thank you. Final question is from Lauren Boothby, Edmonton Journal.
Hi, Dr. Hinshaw. I wonder if you can, if you can elaborate on which types of events can have a maximum of 15 people, why certain types of events and not others, and does the possibility of ticketing, does that include fines? Do you have any idea about what that fine might be for people who don't comply?
The events that fall under this particular measure would be events where people are mixing and mingling, where they're there for that social gathering aspect of it. So the reason that we're focused on those types of events is, again, we have seen about a third of our new cases in the last 2 weeks from outbreaks have come from these kinds of social events. They've come from birthday parties, from housewarming parties, from wedding receptions. So those kinds of things are where we're seeing this active spread. And that is why we are really focused on measures that are setting out that expectation. Again, I want to be clear that just because a gathering has 15 people at it doesn't mean there's no risk of spread. So you can have a gathering of 15 people. If you're not following the rules, you can still get 14 people getting a new COVID case because somebody who attended while infectious. And so we want to encourage not just people to follow that 15-person limit, but also to make sure that they're letting people know if they're sick, they should not attend, that they're encouraging people to stay distanced or masked if distancing is not happening. And so those things should take place even if a gathering is under the 15 limit maximum. The question of fines, there is an up to $1,000 fine that could be levied if someone is in contravention of this. And again, I just want to remind people that the purpose of this measure is to prevent our health system from becoming further overwhelmed and to protect our community. So we are not doing this as a measure to be punitive. We're not doing this as a measure that's arbitrary. We're looking at the evidence of spread. And we have not seen widespread transmission in structured locations such as theaters. We have seen very minimal spread in restaurants where all of the guidance is being followed. And so we're really focused on those events that are high risk while we let those events that are low risk continue to proceed.
Thank you all for joining us. Dr. Hinshaw will provide another update on Thursday afternoon. Have a good day.